So on today's episode of SheMD, we're going to do a mini jet lag episode. And I have two amazing experts, Sarah Wragge, who has been on this podcast before to talk about nutrition. She has an incredible program that so many women I know are on. And Kadee Sweeney, Kadee Fit. She is a fitness expert, a Pilates teacher. She has helped Dr. A and I get the muscles that we have and has worked with some of the biggest names in Hollywood. But more importantly, she's a healer. And she did a workout with me when I got back, and I had such bad jet lag that I really wanted to share with everybody because I literally felt healed when I left. So welcome to SheMD. Anybody that's traveling this summer is going to want to listen or watch this episode. Sarah Wragge, I am so happy to have you back on the podcast. The reason this came to be, and we did this, I called you basically yesterday and I said, please jump on this podcast because Dr. A and I just got back from being overseas and we both came back and she didn't get jet lag at all. And I was destroyed. And I'm always destroyed when I go, even when I go to New York, I just feel jet lag. And so I know I'm probably doing everything wrong and Dr. A is doing everything right.
That's not true.
So we wanted to have, a nutrition expert and a fitness expert to just really tell us, because it's summer and everyone's traveling, what to do, what not to do. So Sarah Wragge, we're so happy to have you on the podcast again.
Amazing. Well, it's funny because I think it's pretty black and white. You can either figure it out how to travel well and stay on your routine throughout your travels, or you totally derail. And I think it has a lot to do with that very first choice that you are making when you are getting onto a flight or in a car or however you're traveling, on a train. And I think a lot of it has to do with hydration and also food choices. So first and foremost, I always preach, as you know, Mary Alice, take your routine with you no matter where you go. So I take my alkalized powder. I'm observing a certain amount of fasting, like a 12 to 14 hour fast. I'm making my first meal protein forward. I'm having something to bridge the gap between lunch and dinner. And then when I go to dinner, I follow the SWW plate. So I'm doing a blood sugar balancing meal. Even if I'm having French fries, I'm just having those last. So I'm having my greens, my steak, and then my French fries. So I think first and foremost, the choice that you make of what you're consuming and the hydration is everything. I think we go on vacation, we think, okay, all the wheels can come off now. Like, let's order the drinks on the flight. Let's get the meal that's provided. And you end up landing feeling bloated and inflamed and definitely constipated. Don't underestimate that as you're going into the air and cabin pressure is dropping, it's harder for you to digest food in flight. And so I recommend having your meal at the airport or at your home before you go on your flight, to ensure that you're properly digested when you get on that flight. And then when I get to the airport, I walk the airport until I am tired. So I am ready for that overnight flight. I do it a lot when I come to LA and I do the red eye. I eat something, I walk and walk and walk. So even though I only have 4 hours on the red eye, really, I can wake up feeling pretty awesome in New York. But if you're going to go to a restaurant or you're going to eat at an airport, luckily there's so many great options now. I would just be mindful of modifying. So something protein forward, you probably aren't going to get a great quality piece of protein. The vegetables probably won't be the best. But, again, this is reality. And this is also not about giving up your life and being weird, for lack of a better term, just normalizing being healthy to the best of your ability. So when you are at, even if it's a TGI Fridays, you could figure out a salad with a protein situation. I would definitely take a digestive enzyme, and I do that almost all the time when I travel because that really, really helps me. But yeah, I think it's also, you travel and you want to enjoy yourself, right? So I'll let my kids get a Kit Kat, or maybe they want some popcorn or something like that. You have to be normal. But I really do think that eating on the flight is the number one no-no. I think drinking alcohol and eating on a flight are two things I haven't done in years, years, years. And when I put my clients onto that, like little, it's a huge, huge deal in terms of how you land feeling if you go to the bathroom when you land, and also how you feel going into your trip.
What digestive enzyme do you like, and when do you take it?
So I like Pure, and I like one specifically called Digestion GB. And I take that in a perfect world. I would take it before or right at the start of a meal. I never remember, and I always just take it right after.
You eat before you get on the plane. You drink a lot of water. You only drink water on the plane. No food. What do you do when you get there?
When I land, I almost always have an alkalize as I'm landing. Like when I land in Florence, which is where my family is, I'll have an alkalize pack. And then I'm going straight for an espresso. Like, get me to the coffee as soon as possible. I'll have a double espresso. And then when I get to her home is when we're probably going to have our first meal together. And again, a lot more water, a lot of like the alkalize. And then when we sit and have a meal together, it's almost always some big piece of protein and then tons of veggies. Sometimes when I'm coming back from Europe, I do a day of just veggies, like cooked and raw, and I sort of alternate. I might eat some squash or some beets, some turnips, things like that, and then like a huge green leafy salad, because I think it's a little bit of a cleanse, but without being extreme. And it's much, much, much easier to digest veggies over proteins. So sometimes I'll just stick to veggies for a day or so when I'm coming back.
So I would say for travel, I'm older, obviously, I'm postmenopausal. My husband and I, like I said, hydration is very important. I personally take a fiber. When I travel, I try to take it twice a day. I usually have my medications that I have to carry in my medicine box.
What fiber do you take?
I usually do Colace, or I might take Metamucil with me. So I usually do some form of fiber. I do it twice a day. I keep myself well hydrated. I do take a low dose aspirin because I don't want to get blood clots. When you travel and you sit in the same position, especially if you're a flying economy, then you need to be on a blood thinner. I take it regardless. I give it to my husband. It's just 81 milligrams. When I leave the house, I take it. And when I come back, before I get to the airport, we each take one aspirin, especially for people who are at risk of blood clots. Pregnant women who travel, they need to take the low-dose aspirin, keep themselves well hydrated. I recommend walking around the cabin. It's very important. A lot of us don't know that we're at risk of blood clots, right? And a lot of us, especially patients with autoimmune, pregnant patients, postpartum patients who recently had any form of surgery, any family history of blood clot, that increases your risk of blood clot formation. So besides hydration, taking a low-dose aspirin is always very, very safe. Fiber, I talked about. For sleep, patients can take magnesium L-threonate with magnesium glycinate. When they're on the plane, they can take the GABA. I like the Don't Stress by Ollie, the gummies. It has L-theanine in it. You can take all of them. They're supplements. You can't overdose on magnesium, and it'll make your bowel movements a little bit better. But the glycinate and L-threonate, L-theanine, you can take for sleep. If you still do that and you're postmenopausal and you have really hard time sleeping and you're not on hormones, then I would say you can take trazodone. Short term, you can just take that. Some patients want to take Ambien. I don't like Ambien or a melatonin long term, but if you're traveling, there's nothing wrong if you can't sleep to do that. If you are on hormone replacement, I would say flip your hormones, especially your progesterone, to the nighttime of the country that you're landing into, because progesterone puts you to sleep. So adjusting your hormone replacement is important. And then, just like she was saying, a healthy diet, low in dairy, low in, high in fiber. But it will take some adjustment no matter how you do it. it takes a minute, but I think I just adjust well because I've been an OBGYN and I've been jet lagged for 30 years delivering babies.
That's
so
true.
my sleep has always been disrupted. So I can sleep when I want, I can wake up when I want. But so it's a little bit different, but I see my family struggling for a few days.
I struggle.
Yeah.
Can I ask both of you a question? Fiber is such a hot topic in women's health right now. It's like fiber, fiber, fiber. We're not getting enough fiber. When I take fiber supplements, I feel terrible, like terrible. What do you recommend?
So in my opinion, and I'll leave it to you, doctor, but I think that when you take a fiber supplement, it requires you to drink a lot more water. And if you don't, it basically like kind of bloats up in your system, and then it can cause constipation. So you need to be really mindful of drinking enough water. I also like a cleaner fiber supplement than like Metamucil or Fiber One or those. I actually like just plain psyllium husk, organic psyllium husk. And the back of the bottle will say like do a tablespoon. A teaspoon is enough. You just need a little bit, and I would do every other day. But I'm with you. Like a lot of fiber supplements can make you bloated and gassy. So I don't know. What do you think about that?
I think, for me, a majority of what I eat is salads and vegetables.
Yeah.
So for me, I never have that big of a problem. Sometimes I do add it when I go to Europe because my diet changes. I start eating pastas. I do stuff in Europe that I normally don't do when I'm at home. And so I tend to struggle more. But for me, having a healthy diet and hydrating is the most important. I have to remind myself to drink. But now I literally walk out of my house with 2 big bottles of water and I make sure I finish it.
And Sarah, in terms of fiber, with how much fiber are you telling your clients to get?
30 to 50 grams of fiber every single day.
So Sarah, give us your top 3 tips for jet lag as we close out this podcast.
Tip number 1 is do not eat on the airplane. Eat something before focusing on protein, some fiber, some veggies cooked or raw, some healthy fat. Number 2 is hydrate on wheels up and hydrate on wheels down. Number 3 is make your first meal when you're in your new destination after having all of your water to be protein forward with lots of vegetables. And even consider just maybe even eating a day of vegetables just to kind of adjust with your digestion.
And your biggest tip to poop when you're abroad?
Fiber. The alkalized powder helps with that, but fiber and veggies, also fruit, like an apple on an empty stomach will really kind of sometimes get things moving. I wouldn't put a fat with it. I wouldn't put a nut butter or something. I would just have the actual apple. And you can always get those in any airport.
I want to take a moment to talk about something that many women don't realize about pregnancy. In the US, about 1 in 10 babies are born prematurely. And what's surprising is that half of those births happen in pregnancies that had no known risk factors, no warning signs. A seemingly normal pregnancy that ended with a baby born before 37 weeks. And a premature birth isn't always just baby arriving a little early. It can mean weeks in the NICU. It can mean watching your baby through the walls of an incubator instead of holding her. It can change everything about those first weeks and months and can also have an impact for years after that. We know that every additional week in the womb can make a meaningful difference for a baby's development and long-term health. One of the challenges doctors have faced is that traditional screening methods fail to identify up to 80% of preterm births, which means most families simply don't see it coming. That's why I'm so excited to tell you about the preterm test. It's the only clinically validated blood test that assesses risk for spontaneous preterm birth. It's a simple finger prick blood test done between 18 and 20 weeks of pregnancy, and it measures specific proteins in the blood to see if you are at risk for delivering early. The results are shared shared with your provider so you can have a more informed conversation about your pregnancy and what care is best for you. There's also strong research behind it, such as a large trial called the PRIME study, which included more than 5,000 participants. The results were significant, with 56% fewer extremely early births and 20% fewer NICU admissions. But what those numbers really mean is more time in the womb and more moms bringing their babies home on time. Dr. A uses the preterm test with her patients because she believes it's important for women to know their risk for preterm birth and to be aware this option exists. So if you're pregnant, trying to conceive, or if you know someone who's expecting, this is definitely something worth learning more about. You can visit preterm.com. That's preterm.com to learn more and talk with your provider about whether the preterm test might be right for you. Again, that's preterm.com. Talk to your doctor about whether preterm is appropriate for you. SheMD thanks Sarah Prognostics, maker of the preterm test, for sponsoring this episode. This podcast is sponsored by MIDI Health. Every once in a while, Hollywood will try to make a prequel of a movie or TV show, and they're never as popular as the original. I think it's because we're so aware of the story and characters going into it. When they don't match our expectations, we want to turn it off. It's kind of similar with perimenopause, the prequel to menopause. Menopause is the phase of life everybody's heard of, the one that shows up in every headline. Perimenopause is the prequel that feels unfamiliar. Too often when you start to experience symptoms, your doctor tells you it's just stress or it's just part of getting older as a woman. It can start as early as 35. For decades, most of the medical community has either ignored it or just flat out misunderstood it. MIDI Health knows this and did something about it. They built the first virtual care clinic for women navigating every stage of this shift, perimenopause all the way through menopause. Created by women for women, which honestly shouldn't have to be a selling point, but here we are. Your MIDI clinician is not guessing. These are menopause experts, hormone-trained specialists who actually listen. And yes, it's covered by most insurance. Menopause has a prequel. Thanks to MIDI Health, you don't have to suffer through it in the dark. Book your first virtual visit today at joinmidi.com. That's joinmidi.com. Okay, let's be honest about something. Therapy is an incredible resource, but it's not the whole toolbox in our sometimes complicated lived experience. If what you're dealing with feels like more than a rough patch, sometimes you need more than a great therapist and a journaling habit. Although those are amazing. This is where Talkiatry comes in. It's an online psychiatry practice, not therapy, not an app, psychiatry. You'll connect with real medical providers who can diagnose what is going on and, when it's appropriate, prescribe medication to help. They also handle the medication management over time, so you're not navigating it alone. I know trying to find a psychiatrist who is good and available can seem impossible. All 800 plus clinicians accept major insurers, so you are using the plan you already pay for every single month, not adding another subscription on top of it. Getting started takes minutes, not months. You take a short online assessment, you get matched with a clinician who actually fits what you need, and you are in your first appointment in days. You stay with that same provider going forward, so you are not re-explaining your whole life every single visit. The treatment can actually evolve as you do. More than 300,000 patients have already found real psychiatric care through Talkiatry. So if you've been stuck in that gap between knowing something is wrong and actually getting help, this is the bridge. Head to talkiatry.com/GMD to complete the short assessment and get matched with an in-network psychiatrist in just a few minutes. That is talkiatry.com/GMD to get matched in minutes. Okay, so we're doing a podcast today on jet lag because I came back from my trip and I was beat up. I felt terrible. And this beautiful, magical Kadee Sweeney over here, we call her Katie Fit, who gives both Dr. A and our muscles, along with so many incredible, women in this town, Pia and Sophia Grange and all my favorite people. You've really transformed bodies. But you literally, with our workout, made me feel like a different person. So I said, Katie, I want to show everybody and we're going to do this for social media. We're going to show the actual very quick things that you did to help me get over my jet lag. But when we left, I said, I feel like a completely different person. So I wanted to do this episode on jet lag because we get a lot of questions about it. So thank you for coming on the podcast.
Thank you for having me.
Break it down for us, what you recommend before you go, on the plane, and after.
Okay, so one of the biggest things about Pilates is our alignment, right? And our spine, our spinal alignment. So just a quick breakdown. When we were born, we're in a fetal position when we are in the womb. So we have a little kyphotic curve natural in the thoracic. You go on your tummy, you lift your head up, then you get that little curvature.
Tummy time.
Yep, tummy time, right, in your cervical spine. And then when you stand up, you get a little curvature in your lumbar spine. So if you think about protecting the curvatures of your spine, anytime really, but definitely during travel because we're in weird positions. Look at me, I'm crossing my legs, throwing my pelvis off. When people are sleeping, they're in different positions. So if you think about alignment, that's key, number one, right? So if you start to feel really uncomfortable on an airplane, number one, sit up really tall, get your shoulders back, right? Like pull your tummy in, get a little natural curve in the low back, put your head back, and just get aligned. And believe it or not, it's kind of hard to sit in a neutral spine position, right? You can feel your back firing. You can feel, I mean, it takes a lot of work to sit up, but you're firing the muscles to protect and to support the spine, which is what happens. And so when you relax, we all kind of slump and relax.
And my back, oh my God, it's just like when I'm on an airplane, it's like, why can't they design these seats
More comfortable.
more comfortably or with lumbar support or anything? I literally, and it's not even now, it's for years and years and years. I get off an airplane and I'm like, my back is killing me.
Yeah. So what happens is we end up going into what's called a posterior tilt. So with that natural lumbar, curvature, you end up losing that curvature in the low back, which ends up stretching the low back out. And people think, oh, my low back hurts, I need to stretch more. Well, when you stretch it more, you actually end up hurting your back more. So what actually needs to happen is the low back muscles need to be fired because they've been stretched out for so long because you've been sitting in a posterior tilt. Or you've been crossing your legs, your hips are twisted, and everything gets out of alignment. So one of the most important things that I feel and with you that I did with you when you got done with your travel was pelvic stability. So strengthening all the muscles around the pelvis to stabilize the pelvis because sitting and being in these weird positions creates instability of the pelvis.
So it's not even being jet lagged. You can be at your desk all day and you're doing this to yourself.
1000%. Sitting is pretty much one of the worst things that we could ever do is sit for long periods of time. So going to that, right? If we're sitting or laying on a plane for long periods of time, it's so important to get up and walk constantly, like every 30 minutes, every hour. So you want to know what my trick is? Before I get on an airplane, I buy about 4 bottles of water. I always pick an aisle seat. I never sit at a window seat, which that's where you want to sit and lay and curl up, right? And I chug water. I make myself chug water because you're dehydrated, right? We get puffy. We need the fluids to keep, and then it makes you get up and have to go to the bathroom. So getting up and walking to the bathroom, stretching whenever you get up, it's really good to get on your toes and pump your, heels up and down, calf raises to create blood flow in your legs because, blood flow is an important issue. You have spoken about blood clots, right?
Very common. I mean, not very common, but people are at risk of forming blood clots. And when you sit in the same position for hours, let's say you're going to Europe, you have an economy seat that's by the window, you're embarrassed to get up and walk around and wake the other people up, you are at risk of forming blood clots.
Well, and on that note, I mean, you have to have a lot of hamstring flexibility to stick a leg up. I do that. I know it's probably obnoxious and not proper etiquette.
I'm literally like my legs, I stretch myself on the
not
thing.
proper etiquette, but elevating your feet. Well, you have
to be in business class, my friend.
Well, or you can, just stick your foot up on the chair in front of you. I mean, I like to straighten my leg, but again, not everybody has that hamstring flexibility, but just getting your feet elevated if you can. Again, it's not proper etiquette, but just sticking your, foot up, or if you are at a window, trying to stick your feet up, or even just pulling your leg up and trying to give your hip a little bit of a stretch and or sitting into a piriformis stretch, which is crossing your ankle over your knee and just rocking back and forth to create a little bit of mobility in the hips. But I also think the most important thing is to get up, go to the bathroom, walk around, move around, big good morning stretch, right? Little lateral flexion for the spine, side to side, little rotation, little twisting, little hopping, bouncing. It would be great for the blood flow to the legs and the possible blood clots. I always pack electrolytes and I drink water and I never eat on airplanes. Never, never, never.
Number one
I eat
rule from this
never,
podcast.
never eat protein, eat your fat, healthy fats, before you get to the airport. And then again, I just chug water the whole time while I'm on an airplane.
So if you're flying to Europe from Los Angeles and you're on that plane for 11 hours, you better sleep because otherwise you get hungry and you want to eat.
100%. Well, some of those flights are usually night flights, right? Or nighttime flights, so overnight flights. So people are going to end up asleep. They're going to end up in a funky position. The moment you wake up, you get up and you walk around that plane, go to the bathroom, do your calf raises, do your good morning stretches, lateral stretches, rotation for the spine. The other thing that's so important that is so simple is your breath, breathing. Inhaling through the nose, getting oxygen to the brain, exhaling through the mouth. It's going to create circulation, get the blood flowing, and get oxygen to the brain. On planes, there's a lack of oxygen, right? We lose a little bit of oxygen. It's not as, we don't have as much oxygen. So just simple breathing. It's also good for flyers that are anxious flyers. I have a lot of friends, a client that I talked to today, she's like, what do you do if you're an anxious flyer? Focus on your breathing. Also, too, just when you breathe, you sit up, lift your shoulders up, and then roll your shoulders back and give a big exhale. And then while you're doing that, sit up on your sit bones and try to find like that neutral spine position. Inhaling through the nose, grow tall, letting the shoulders lift a little bit, and then exhale, relaxing and rolling the shoulders back. The other thing, sitting for long periods of time, your glute muscles are like dead. They turn off. So I know this sounds funny, but it's sitting there and just squeezing your butt muscles.
Oh, I've never thought about that.
And then releasing.
It's like doing Kegels.
And then little Kegel, squeeze, and then release because you're sitting and you're losing. And then if you're posteriorly tucking, think about what we're doing to our booties, right? We need to have strong glutes
What
too.
does that mean, posterior tucking? I'm trying to understand that.
Well, you know anatomy better than I do.
Basically, you're doing
right?
this. You're
So
pushing your pelvis forward.
Think of your pelvis, which I feel like this is good for everybody. Think of your pelvis as a bowl, right? And your spine sits in that bowl. When you tuck it, your ASIS, anterior superior iliac spine, goes backwards, posteriorly tucking the pelvis, right? So an anterior tilt would be too far forward and too much of an arch. A posterior tilt, right?
Which is when you slouch too.
You're losing that lumbar curve. So you want to sit up, move the flesh underneath your hips, move the flesh. We could do this on the airplane too. Move the flesh underneath the hips and you'll feel those two bony prominences. Those are your sit bones, right? So you're seated on your sit bones. And again, let's just, while we're talking, sit here and see how hard it is to sit neutral, right? And then pull your tummy in. Now your abs are activated, your low back's activated. Now do your glute squeezes. Squeeze.
I need to take you on the flight with me.
Exactly. And what do you do when you land?
Okay. Well, this is where you and I,
We're going to show it on social media.
And a ton of my clients were texting me whenever they got done, traveling. They're just like, I'm in so much pain. So first of all, wake up in the morning, get in morning sunlight. It's going to help you reset your circadian rhythm because if you're traveling time zones, your body's all off from that, and morning movement immediately. So specifically what I did with you, again, all about the curvatures in the spine, put you on a neck roller, roll your head side to side to keep the natural cervical or the natural lordotic curve in your cervical spine, right? I stabilize the pelvis, inner, outer thigh bridging, right? Strengthen inner thighs, outer thighs for pelvic stability. I laid you on a foam roller to get you in the opposite direction of the way your spine is going on a plane. On a plane, we're rounded. We're in that hyperkyphotic position, right? That rounded shoulder, hump back kind of position. So I got you backwards. I took you backwards. And then we did some extension for the spine. We did rotation. We did breathing. What else did we do? We did a lot. I also, the foam roller, just laying flat or even laying on your back on the floor and bringing your feet together and your knees apart will set your lumbar spine with that natural, neutral spine is, what I was focusing with you. We did side lying booty work to strengthen the glutes. So basically what I did was turned on all the right muscles, and then I got your spine aligned and then got you breathing. Rebounding too is huge for your lymphatic system, which you love to jump on the
I jump on a little trampoline, like bounce, 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 bounce. She jumps on you do a plate thingy. What's that
I
thing
stand
called?
on a shake plate morning and night.
For how long?
10 minutes while I'm brushing my teeth and I'm washing my face. It resets my nervous system, gets my lymphatic system going, and creates blood flow.
Creating SheMD has been one of the most rewarding experiences of my life. And it's also part of a full-scale production company I run day to day. Like many content-driven companies, we often need to bring in extra support project to project. But up until now, I had no way of fixing the time-consuming aspect of team onboarding across all of these project-specific needs, which is why I'm so glad I learned about Gusto. Gusto is the premier online payroll and benefits software built specifically for small businesses. The real game changer for me is that Gusto handles all the documentation, the tax forms, and the benefits selection, all within one single platform. That means a new hire shows up on day one ready to go straight to work, instead of spending days buried in paperwork. Gusto is one of the tools where once you experience it, you literally can't imagine going back to the old way of doing things. It gives your business the infrastructure of a much larger company without any of the cost or complexity. Gusto lets you show up for your team the way they deserve, organized, on time, and completely taken care of. Gusto can make you a better leader for all of your teams. Try Gusto today at gusto.com/GMD and get 3 months free when you run your first payroll. That's 3 months of free payroll at gusto.com/GMD. Gusto.com/GMD. Go to gusto.com/GMD. You know that one multivitamin everybody takes because it's the easy default? The same bottle, the same dose, no matter what your body actually needs that week. Your gut doesn't really work off that model. And it turns out your probiotic shouldn't either. Most of us just grab what's ever on the shelf and hope for the best. You deserve better. Ollie launched a new line called Precise Probiotics, built around a really smart idea. Instead of one generic probiotic trying to do a little bit of everything, each one is clinically studied and targeted to a specific part of your gut microbiome. So you're actually supporting what you need, not just guessing. Your probiotics just got smarter. There's skin support, stress support, and metabolism support. My favorite two are the skin support for healthy, hydrated skin and stress support, which helps manage cortisol levels for a healthy stress response. Each one still covers the fundamentals, your digestive and immune health, and then goes further into the lane you actually picked. These are about as low effort as a wellness habit gets, which, if you're anything like me, matters more than people admit. The benefit for most supplements is a slow build, not a switch you flip overnight, and that's exactly how it should be. Quick note, and this one matters. These three are designed to be taken on their own, not stacked together. You can find Ollie Precise Probiotics with skin, stress, or metabolism support at a Walmart near you. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. If you watch CMD on your YouTube channel, you'll notice that Dr. A wears her scrubs for most of our interviews. And yes, sometimes that's because she's literally coming straight to our studio after a full day with patients and doesn't have time to change. Dr. A looks good in anything, but the brand Figs makes it effortless for every person who needs to wear scrubs and wants them to feel like their favorite clothes do. Figs completely disrupted the medical uniform industry by replacing traditional, boxy, uncomfortable scrubs with tailored, stylish, and high-performance workwear. They look great and they don't feel like a wardrobe compromise. When you spend your entire day taking care of other people, nurses, doctors, techs, and everyone on the floor, what you wear is not some afterthought. It has to survive the unexpected and the planned moments of a 12-hour shift. This is the whole idea behind Figs. They make premium healthcare apparel and accessories that are designed for what healthcare professionals go through during a real workday. Figs uses high-performance fabrics that are lightweight, breathable, and have 4-way stretch so that you can move the way your job actually demands. Expertly tailored dozens of styles and colors so you never have to choose between looking like a professional and feeling like an actual human being on your shift. If you have dedicated your life to taking care of other people, take care of yourself by choosing Figs as your workwear. Right now, you can get 15% off your first order at wearfigs.com with code FIGSRX. That's wearfigs.com, code FIGSRX.
What about itching? When I go on those plates, I think I have a
blood
genetic
flow.
mutation. Yeah,
That's
but I
what
get
it is.
histamine release too, which when I did my full genome sequencing of my DNA, they say I get itchy because of that histamine. It's a genetic mutation. I have it. And I have a hard time. Like I can do a few minutes of it, but then I start like.
So that is blood flow. It's actually a good thing. But what I would do is turn the knob, make it, don't do it as you got to start. Yeah, you got it. The shake, you have to do a lower vibration and then build up to it. But that's good.
You
The
do
itchy
10
is
minutes in
good.
the morning and 10 minutes
I
at
do
night?
10 minutes.
Do you do it?
Do you know?
I jump on a trampoline. I have a little mini trampoline that I do the same thing. And
No, but
I'm also
that's
using it for
different,
stress.
'cause
But mine is set right in front of my sink.
Yeah, she just brushes her teeth
I
on it.
brush my teeth. I wash my face. I do all my facial products
While you're standing on it.
while I'm standing on the shake plate in front of my, and yeah, and at night it helps me to like relax to go to bed.
Is there a brand that you recommend?
I mean, the Power Plate is like the Mac Daddy of them all, but I think one of those can be like the um lowest version, or the remedial version is like $2,000, but you can get them on Amazon for $70 or $100.
From $2,000 to $70?
It doesn't have as much power. I think the Power Plate is the Mac Daddy if you can afford something like that. But I think the $2,000 one is also kind of big, where you would want to put that in a gym, but just one to just stand and brush your teeth on. But definitely adding it to your gym, because I know you need more equipment in your
I know,
gym.
right? I have a question. What about EMS? These jackets that electric, muscle stimulators.
So I personally we know a couple, an older couple that had somebody come into their house that was doing that. And I think, again, that like vibration and like the shaking, they ended up like not doing it. I personally have not tried it. I think on some levels it can be good. Remember when we were working together and we couldn't turn on your lateral glute muscles, and I sent you to that physical therapist that had you buy that thing on
Amazon, these little things that turned
and
it on when
would
we were working out,
stick
and it worked.
on
Yeah.
there. I just think you have to be, just like anything else, really careful with the instructor. You have to communicate your needs, how it feels. Also start really, really, really light. But if you're like a sensitive person, sensitive to things, I would be very, very cautious.
I did it, and I was definitely seeing results. I would do 20 minutes of it once a week. But for me, it was very inflammatory.
Yeah.
Do you know, I'm one of those people. I need, I love exercising with you because, I do my breath work. I stretch. You stretch me at the. I'm more of that person, and I feel like this 20 minutes, I was like, it was adding more to my stress, and I would get anxious before she would come.
I was going to say, I know you're also really big on yoga too, and that's very helpful for you because you are so busy. You work so much. You put so much into other people, and there is a fight or flight in that of go, 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 work, 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 work. So you're going to always benefit from the things that help you relax and go into your rest and digest. Right? Your
But I think most
parasympathetic
people-
nervous
don't you think
system.
most people
Yeah,
are like
I'm the
that?
same way. I need that calm. If you're like us, who are just like, constantly like this, our exercise needs to be a little. I mean, it can be hard.
Less
you can still
inflammatory,
do, yeah, exactly.
I guess.
You also told me that the first thing that I should do whenever I got anywhere into a hotel room was lay on the floor and put my legs up.
Yes, which is what we were talking about on an airplane. If you can somehow, if you have the luxury of being in a business class or, first class seat, that you put your legs up and let the blood drain, because it's, we retain water whenever we travel, but also it helps you relax. It's a yoga pose. When you lay on your back and you put your feet up against a headboard, it's a relaxing pose. I always get my legs up and just lay there for like 10 minutes and see how you feel. It's just like standing on the shake plate of like getting you to
You know
relax.
how every time I board a plane, I always ask this question. I'm like, why is it that they can't put those massage chairs that you sit in? I'm not saying for a 2-hour flight, but if you have a big plane that's flying internationally, why wouldn't you put these massage chairs for people to
Let's
sit
create
in?
a SheMD airplane.
I know,
Let's
right?
start an
It'll
airplane.
massage you.
On that note, there is absolutely no lumbar support on an airplane seat, right? So you can always take, which I think I've probably I share it with all my clients. It's a little pillow about this big that you can buy on Amazon. It's like a hippo pillow. It's black. It's kind of foamy. I have them. I drive with that in my car behind my back, and it saves me from back pain being in my car
Who
and
makes
driving.
it?
It's on Amazon. I think it's called like a hippo pillow, but it's literally about this big. It's black. I can send you guys
Yeah,
the
send us
link,
the
and
link
maybe
so
we
we'll
can
add
link
it.
it
Yeah,
somewhere.
yeah.
But it's in my car right now on both sides. And I would highly recommend taking that on airplanes whenever you fly, because it'll give you, and that helps you to sit up in neutral support or neutral spine, having that lumbar support.
Okay, awesome. So now we're going to go do the quick Kadee Fit jet lag cure. And we're just going to do exactly what you did for me, which
Yes.
we'll share on social media. It's
Perfect.
like you don't need heavy equipment. You don't need anything. It was completely changed how I felt.
Your words, you said, I have been healed.
I did. That's
She
how I
said,
felt.
I have been healed. I was like, oh, you have no idea how happy that makes me feel.
All right. Well, you're the best. Thank you
I
so
love
much
you
for all
guys
this
so much.
information.
Thank you
I think
so
it's,
much.
everyone's traveling. It doesn't, and by the way, this is great information for just living day to day, just to help your back out.
By the way, every time I exercise with her, I always tell her, I'm like, stand in front of me, because she's my motivation. I'm like, I want to look like you. I'm like, go stand in front of me, and I'm like doing my.
I love you guys so much.
And how can everybody find you?
I'm Kadee Fit, KADEEFIT on Instagram, kadeefit.com. I have an app.
Okay, great. And
yes.
will you put this jet lag workout on your
Yes, of course. I think we might have to do 2 parts.
Okay.
Two series.
And
2-part series.
one thing about you is you have your online classes, which I
Yes.
think are so important for people who travel. They can join your online classes.
And
so that's really good.
Yes.
Yeah, and people that don't live in LA and that can't come see you. It's just
Yes.
you're the same workouts that you give me and Dr. A and all your big celebrity clients, you have
Yes,
online.
and I'm opening up a studio space. I'm going to be filming all of my classes, reformer, Pilates classes, and they're all going to be uploaded for online.
Well, you are a healer, in my
Thank
opinion.
you.
You are. She is.
But she meditates with me. I used to what you do. That's what I'm saying. It's the whole package with you. It's not just, I call it torture because I don't like exercising. It's not just torture. It's you actually make it pleasant. Not only I see results, but I'm calm when you leave, and that's priceless for me.
And I think
you.
there's something to be said. We're talking about this, that, women are so high functioning. We're moms. Sometimes we have jobs. Sometimes we have huge lives. It doesn't matter. We're being hit on all sides. And I think there is something to be said about our exercise does need to feel like it heals us instead of adding another layer of this pound, 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 pound.
Yeah,
so however you
there's
can
a
find
lot
that.
of things that I do not do. I'll never have you do a burpee. I'll never have you
that's why I
pounding
love
up
you.
and down. I don't even have you guys do arm work hardly, where you're doing anything except for laying down and being completely supported. But it is truly a joy for me. And I feel like my mission on earth is to, help women, and I love encouraging y'all, and it brings me
love it.
so
She's the
much
best.
joy.
All right, let's go suit
Thank y'all.
up.
Yes.
And if you go to our Instagram, we're going to have our Kadee Fit workout. So
Yay.
for jet lag.
Thank y'all.
Thank you so much for joining us, Kadee. Thank you so much for joining us, Sarah. The tips you gave us today, you can use whether or not you're traveling, just life in general, for making your body feel amazing. So thanks for coming on SheMD. We love you guys. Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.